Therapists and non-therapists, I have a lot of things going on right now that I think you all are going to find benefit in. So I'm going to give you a menu of options of things that I have for you, and hopefully you can choose one or two and join us. So for therapists, we have a CE workshop on September 26th that is about practicing competently with chronically ill clients, clinical, ethical, and collaborative care. I'll be going over things like when to use ACT, CBT, PRT, IFS, SE, as well as how to differentiate between things like factitious disorder, malingering, all of those awful names that our clients hear way too much when really they're dealing with a actual chronic illness or health anxiety or something like that. So we'll be going over all of that in my 3-hour workshop on September 26th. We also have me and Victoria Rodriguez of Revive Counseling in Louisiana. We're doing a 6-week educational and consultation program. So that will be every Tuesday night at 7 p.m. Eastern from September 23rd to October 28th. And that's 90 minutes each week where we're going over education around working with chronically ill clients, and then also an hour-long worth of consultation. So you get to bring your cases to us, and it will be such an incredible group. We have 9 people signed up so far out of 20, and we would love to fill up the rest of the group, but just know that the people who are in there already are amazing. I know most of them in there, and I'm so looking forward to this. So next, this is a really exciting one as well. Jason Tyrion, if you've ever been in any of my consult groups with Jason, you know how wildly educated and smart he is around not only the body as a physical therapist, but just compassion. He has so much compassion for the people in chronic pain. So we are leading a 4-week group. It'll be on Wednesdays from 9:30 a.m. to 10:30 Eastern. And it's a movement group. It's also education around the body. And this is all about the idea that therapists, we are sitting all day long. And we all know that sitting is not the best for you all day long. But as Jason will definitely point out when he's teaching in this group, it's not really the sitting, it's the sitting with the tension that we hold. So he's going to be doing some really simple and attainable, easy to understand education around the body and breath and movement within our profession. And then we'll do some practical hands-on movement as well. That is 4 weeks long from September 17th to October 8th, Wednesdays at 9:30 a.m. to 10:30. However, if any of you feel like 10 to 11 would feel better for your schedule, just let us. Right now we have it at an hour, but honestly, Jason and I are both open to doing 9:30 to 11 to just make sure that everybody gets what they need from the group. So just reach out to me with questions, destiny@destinywinters.com. And then, of course, my free monthly consultation group. As always, we've got business consultation on the first Friday of every month and clinical consultation on the third Friday of every month. And that is completely free, always will be. So join us there. If you are new and kind of want to see what working with me is like, that's a great place to do that. Now, for non-therapists, for those of you who listen to my podcast because you simply have a chronic illness, you are interested in, taking control of your healthcare and really learning how to navigate the medical system. For you all, I have a workshop every single month that is purely educational, and I always do it with another medical professional, another therapist, or another type of medical professional. And this month on August 30th, we'll be doing When Everything is Connected, Understanding Autism, ADHD, and Chronic Health Conditions. And that will be with therapist Rowan Crawfish, who will be talking about how to advocate for yourself within the system and just validating the experiences that we all have when we have these multiple chronic conditions. Additionally, I always have open enrollment for the membership Welcome to the Waiting Room. This has 3 or 4, I think we're up to 4 now, support groups, 3 support groups and 1 co-working group every single week or every other week. And we've got a sex and chronic pain group, a general support group, a mindfulness/breath group that Jason leads, and then a co-working group on Mondays. And brand new, I have a family membership for Family Welcome to the Waiting Room. So this is for your family members who maybe feel like, you feel like they don't quite understand. You just want somebody else to explain things to them. Every other Tuesday, we will have a support group for them, and they have their own separate membership. The memberships are $17 a month. And then I still do my individual therapy work with folks, but I am moving more and more into intensive formats only. So that means 2 to 3 days in a row. We don't meet weekly like regular therapy. We meet maybe once a quarter or once every 6 months or once a year, even depending on what your needs are. And that is open for people who live in Georgia, Florida, or Colorado. Or you don't have to live in those states, but as long as you were physically in those states at the time of service, that's fine too. So if you're interested in any of those options, all of the links for all of those things will be in the show notes, and you can, as always, email me with any questions that you have. Now, onto our episode. I'm interviewing Dr. Rita Gupta, who is a doctor of osteopathic medicine. She's been practicing for over 20 years, and we have a really fantastic conversation about basically the choice between holistic medicine and Western medicine, and I really hope you enjoy it.
The Chronic Illness Therapist podcast is meant to be a place where people with chronic illnesses can come to feel heard, seen, and safe while listening to mental health therapists and other medical professionals talk about the realities of treating difficult conditions. This might be a new concept for you, one in which you never have to worry about someone inferring that it's all in your head. We dive deep into the human side of treating complex medical conditions and help you find professionals that leave you feeling hopeful for the future. I hope you love what you learn here, and please consider leaving a review or sharing this podcast with someone you love. This podcast is meant for educational purposes only. For specific questions related to your unique circumstances, please contact a licensed medical professional in your state of residence.
My name is Dr. Rita Gupta. I'm a board-certified family and integrative medicine physician. I've been working in medicine for almost 20 years now. It's hard to believe. And I've been in the traditional model mainly. But about a few years ago, I really got interested in kind of branching out. I've always been interested in integrative medicine. It's kind of something I knew about. So I took the leap and I joined the fellowship program. It's the Andrew Center for Integrative Medicine. It was a 2-year program. And really from that, it opened the path to really understanding mind-body medicine and really the interconnection of the mind and the body. And now I've really felt that this is what was missing in traditional medicine. I really do believe the healthcare system has a lot of great points, but it's really broken and it's very isolating for people with chronic illness, chronic pain, chronic persistent symptoms, people who just don't have a clear answer of how to get better. They don't know what the roadmap looks like. And honestly, it's like feeling hopeless because you're not getting any validation or support. And I think as clinicians too, we're meant to really help people and get them to feel better. So we feel inadequate ourselves when we're not able to provide a solution for people's problems and suffering and debilitating suffering on top of that. So my background is I'm a DO physician. It's an osteopathic medicine physician. I do practice in an allopathic role because I did my traditional residency at Mayo Clinic in family medicine, and I'm board certified through the American Board of Family Medicine, which MDs and DOs both take. But our philosophy from the get-go is a little bit more holistic. So it's really about looking at the whole person and kind of understanding the relationship between structure and function, and really tapping into that body's innate wisdom to heal itself. And I think fundamentally, I've always believed in that if you get out of the way or create conditions for healing, the body is going to heal. And that really goes along with mind-body medicine and just my interest in that and really being able to help patients from a whole person perspective. I've had many patients over the years who've actually came to me because I was a DO physician, because in my office there were DO and MDs working side by side. So some people would preferentially seek me because of that holistic philosophy.
Yeah. Can you give me an example of, I actually love this, like thinking about it even within the traditional medical setting, and there's a DO and an MD in the same office. What do you think drew people to you as the DO, and what did you do different than your colleagues?
Yeah, I think in some senses, because of my training and just understanding how structure and function are interconnected, it really got me into thinking about a person like not just it's their physical ailment. Okay, they have an abnormal liver enzyme test, or they have a right shoulder or left shoulder pain. Like I really saw them as a whole person. And I was really trying to dive in deeper to really understand what's going on in your life right now. What does your home life look like? What are your stressors? What are your hopes? What are your disappointments? Like, it's funny that you would think I would go into all of that based on a liver test being up, but then I would find out maybe they're taking some supplements that are just not, that are picking up their liver test, or maybe they're drinking a little more alcohol, or maybe they feel really stressed out and they're not exercising and their BMI is increasing, just to give you some like
Yeah.
examples, but it really gives you a context of what's going on.
How would that differ from maybe how a traditional MD would see the same labs and then how they might approach that session, that appointment?
There's always not a good or bad approach, in my opinion. So I think it sometimes a traditional MD might, and again, this varies amongst the DO population and the MD population, because there's holistic MDs and then there's DOs who are very much like almost really never got absorbed that philosophy or really felt it was right for them. So I think that MD would probably, traditional MD would just really dive in there and be like doing the full workup, which I would still do too, but really getting that slew of blood tests that are like this long and getting the liver ultrasound and really just thinking worst case scenario, like what's going on here. It's just, and almost leaving out anything psychosocial. Like it's really the
Yeah.
bio part. It's not the biopsychosocial.
Yeah, that makes sense. And I'm curious if we can go even more granular. And yeah, absolutely recognizing that there are more holistic MDs, less holistic DOs. So when you've got the less holistic, let's say, person, just when you say they're just seeing the labs, does that mean they're not asking about lifestyle? Does that mean they're not, what is that like main difference between how they're going to approach that?
I think they're really looking at it from like a chemical, structural, tissue diagnosis perspective, like a physical, material, science based approach. That's the best way I could put it. And it's like looking at the body in isolation of everything else, of the environment it's in, of the mind body connection, our thoughts and emotions. It's really just isolating to like, if I were to dissect something, like just in a very precise way, like what is causing X to happen or Y to happen. But the problem is, it doesn't really capture real life now as we see chronic illness and disease increasing, actually, even with all the lifestyle interventions. So it's not even what we do for our bodies to heal, it's how we do it and how we feel when we're doing it, in my
Yeah.
opinion.
Yeah, there might be two different ways to treat something, and you and the other practitioner might have the exact same toolbox, but through maybe your line of questioning, you figure out that this option is way better for the client based on their lifestyle and what they are motivated to do or not motivated to do. And you can maybe choose the right treatment for them based on who they are, rather than just, I'm the doctor and I always do this treatment for this thing. Is that accurate, or would you edit that in any way?
I think you said it really, and what it brought to mind is that idea of the style, right? Like medicine used to be a very directing style. Okay, you're like, here's the clinician, here's the patient or client, and the clinician tells them what to do because they have the experience and the knowledge. But when you're doing a more holistic way, you're using motivational interviewing, where you're trying to help be a guide for the patient to uncover their own wisdom and their own body's innate knowledge. So it's a more flux of a situation where it's ebbing and flowing. It's also like when we are when we learn how to, one of the first things we learn in our medical education is how to take a really good history and physical. And they say that 90% of what the answer is, or what we're trying to almost uncover a mystery, if you will, is in the history. It's what the patient tells us. And it's like modern medicine has moved away from that concept because we've gotten so heavily relied on diagnostics and blood tests and measuring and anything that we can't physically or tangibly see or measure or take out or put in, or it's like it's we can't we it has to be a material thing, and
Yeah.
that's gotten us away from the patient's innate wisdom.
Yeah. There's a really funny story I read online years ago, and it was like, actually, I think the last time we talked, that I told you this story, but so this family doctor, one doctor, whole town, husband, a guy comes in for his hearing. He can hear sometimes, he can't hear other times. And because the doctor knows him and his family and all of his family and his life history, I'm actually really bad at like remembering the punchline, and the context. But the punchline is basically you have selective hearing because you don't want to hear what your wife is telling you. There's nothing wrong with your ears, and the tests prove that, and this has nothing to do with it. It was a really funny story because it's like, yeah, sometimes the context is very important.
Yes.
But on a more serious note, I think what I can, like you're talking about, even just the example of the liver enzymes, and of course, people are not always honest on their history and their intake because rightfully there's a lot of fear around, if my insurance company knows that I even had a drink of alcohol, then I'm going to be denied for life insurance later, like stupid stuff like that. But if you know someone's a drinker, or if they're not a drinker at all and they've got these elevated liver enzymes, like those are two different routes you're going to take with that patient. Maybe there is a medication that, depending on where the levels are and what's happening, that would be the same medication for both of those people. But we have to have more of a conversation around the alcohol if that's contributing to this liver issue, which I think a lot of doctors don't want to have. And it's not because, I think they would probably say, because one, patients don't want to hear it. They don't want us to tell them you're an alcoholic and you have to stop. Yeah, but that's also because they don't know you. They see you for 3 minutes a year, and it takes a trusted relationship to be able to tell someone you've got to cut down on your alcohol use. It's really killing you. Like, it takes a lot of trust in a relationship to be able to say a lot of the things that we sometimes have to say to clients.
Yeah, and you've highlighted so many points, like that relationship. And unfortunately, that relationship with your GP or your primary doctor, it's getting eroded. There's no time in the mouth. They say there's 7 minutes for an appointment now.
Yeah.
And a lot of people don't even know their GP, or they don't even have a GP. They don't go to there's no such thing as the annual appointment anymore. It's just you go in when you need something or something. And I know I guess, a Generation Xer. God, I can't keep track, but I know the younger generations really don't even have that experience of what it would be like to really have somebody you trust and have a practitioner who's really on your side, supporting you, there for you. So it's a lot of fear and
Yeah.
stigma, especially chronic pain and illness. It's always that feeling like you're not better yet. Why aren't you better yet? What's wrong with you? Instead of your needs are not being met.
Yeah, exactly. Yeah. Why do you think it is so difficult for the system to help those of us with these complex chronic conditions?
I don't think it's from lack of not wanting to help. I just want to say that first because that really comes to mind. I think a lot of us go into any healing profession where you're helping others, you go into it because you want to help others. You gain a lot of your own personal meaning and reward, and it's a purpose, and it feels good to know that you're of service to helping others. But I think a lot of it is everyone becomes a victim of their own system. And I think a lot of healthcare workers are going through burnout right now and frustration with how the healthcare system is broken, not even for their own work-life balance, but maybe also for their authentic values of what they be happening and they're like having to participate in it, but they don't want to. And then there's a lot of judgment and stigma within the healthcare system. So you have a certain belief system, or you believe in looking at things more holistically. Maybe there is some derogatory views from your colleagues about that. And oh, you're just pursuing holistic and just it doesn't have that research science base. But the neuroscience is catching up on how mind body medicine is helpful in real physical symptoms too. And then I think people are just not informed. A lot of this work I found was really through my upbringing because I was born in the United States, but my parents immigrated from India, and there were a lot of Ayurvedic principles that they were bringing in to our upbringing just around food and rituals and human bathing and timing and just all these things, which I didn't really know was like ancient wisdoms of a whole health science. I really learned that in integrative medicine fellowship. But I think I was ingrained with that holistic view. And then I benefited from a lot of this work with my own chronic pain and illness and living with chronic pain and being a patient in our broken healthcare system. And also feeling that burden of like, why don't I feel better? Or why isn't this healing? Like really feeling that as a clinician, heal thyself. And I was not able to fix it, basically.
Yeah. I'm curious if culturally as well, if that was a message instilled in you too, like the need to fix. And if you can't, then there's a pressure of what are you not doing right?
It's possible, yeah. I mean, definitely in a lot of minority cultures who live the American dream and come here to the US for land of opportunity, it's, I think, a lot of pressure to succeed and be high achievers. And I sometimes say overachievers. So there's a lot of that people pleasing and personal pressure and sense of having to validate ourselves, like through our profession or through our family duties or being the good role model or wife or daughter, as a woman, mother, just so much pressure for sure.
Yeah. It just all brings to mind whether we're talking about, I always am going to lean into that balanced approach of evidence-based medicine with a holistic functional approach to understanding treatments and lifestyle, because not every medicine is right for every person. Not every treatment is right for every person. And I also believe that the placebo effect is really strong, and that's a good thing. I think if I'm going to believe my way into feeling better about something, hey, I'm all for that. Like when it works. Of course, it does not always work. And in those cases, we're looking to the healer, the doctor, the practitioner to help us in a way that we can't help ourselves. So I'm just curious what you feel like your role is with the patients that you see or the clients that you see, and how you balance evidence-based and holistic practices. And do you practice from an Ayurvedic? Like, what should somebody expect when they are in a session with you?
Yeah, thank you for highlighting all that. All of that. I think what I would say first is that working with me is really about just taking in all of my experiences clinically, professionally, because I do believe how we show up professionally is how we show up personally. So a lot of this work is so intertwined. There's, of course, my traditional medical knowledge and integrated medicine knowledge, but there is my lived experience, like I mentioned, growing up with Ayurvedic principles and having my own chronic pain journey. So having that awareness, I think personally has really been helpful for me to understand how powerful it is to be for my clients. Because when you can see that, then you have choice, right? And when you don't have that awareness, not that having awareness is a good or bad thing, but just by having it, it does open the world to choice. And it can really help us see that we have options and also see that we're all interdependent. It's really isolating, even on the clinician side, when you're dealing with a lot of things that you cannot really you want to be like, think you're omnipotent and, you're going to just solve it for everyone. And that's why I love evidence-based medicine, because it says, okay, look, this works, or look, it helps. Evidence-based also can go so far too, right? Our society validates it because it's evidence-based, but it's not gonna work for everybody. But if it improves someone's lifestyle where that they can enjoy life, they can be a part of life, they're not on the sidelines, which I felt like I was on the sidelines of my own life. I feel that a positive effect. And I just feel we all need support to do this work. There's a reason why ancient wisdom knew, like, we need healers. And we are all capable of being a healer too. And that's the beauty of this. It can have this ripple effect that when we help somebody else, we almost change a whole dynamic in a family system. If one member has chronic pain or an illness, or there's so many different, just shined a spotlight on so many different scenarios on how this has a ripple effect for others.
Yeah. Yeah. So in your work, would you say that you practice more like a functional medicine practitioner who's looking for some kind of root cause somewhere? Or are you more so coaching somebody through the medical system that they're still going to be involved in and they're still going through, but you're coaching through your medical knowledge of, have you asked your doctor about this? Or have you looked at this lab? Or have you looked at this lifestyle modification that no one has taught you about yet? Or yeah, which way does your work tend to lean?
My work is definitely more in the coaching capacity. I work as a liaison with helping when people get like a directive from their physician or functional medicine doctor, and then they go home and they're not sure how to implement the intervention or how to take the medications or change their lifestyle. So I can give them some more support and guidance around that. I think what I really provide is hope, because I'm really giving them the neuroscience-based research of how they can rewire their brain in terms of reclaiming their life or getting on with their life. Maybe their pain doesn't decrease to zero, but it may decrease in intensity. It may help them stop living life in that small circle that many of us who have chronic pain and illness will do, because we have a lot of fear about re-engaging with things or things that are going to make our pain or suffering worse. But really, my goal is to help support others with the neuroscience and my medical knowledge, and also just to let them know that they're not alone and that their symptoms are real and valid, and they deserve to get the treatment they need. I get emotional sometimes because I think a lot of it is self-compassion at the core. And that really is what opened the door for my own healing, is really when we understand our own worthiness. And it's things that we didn't get from our upbringing or from our educational system or culturally. When we really have that voice to be able to speak up our own needs, that's really what healing is about. Healing is not about a perfect state of nothing, because that's not the human condition.
Yeah. Um, I want to ask a little bit more controversial questions, but I'm not sure. You can just tell me like where your comfort level lies, but I would love to know. Where do you stand on vaccines?
Yeah, I believe vaccines are good. I think they're not causing any harm to the body. They're not the active virus. And if they are the virus, they're attenuated. So,
Okay.
yeah.
Can I then ask you, I'd love to, this has been in my circles online a lot, and I'm going to move my desk down. I'm going to ask you about, you can explain that the vaccines did not cause anyone's chronic illness, how it can actually maybe prevent chronic illnesses, and also about how that people have this kind of misconception around, I got the vaccine, I should never get this illness, and how that's not how it works, and yet it still protects us from X, Y, and Z. Is that a conversation that you're like willing to have here?
I'm happy to make some comments about it. And I think what happens is a lot of times we create a lot of emotions around certain of things, like it could be a vaccine or it could be an illness. And our mind, as we know through the placebo and nocebo effects of the power of the mind, and these are not things that the mind just makes up and and then we believe them, they can cause real neurochemical changes in the body. Like we can see that when our face gets flushed, when we're embarrassed or our stomach starts hurting, probably the permeability of our intestines is changing due to those thoughts. So this is real. And I've seen patients actually who, of course, a lot of people are really suffering with long COVID. And I've seen patients who didn't even get COVID, but they got the vaccine and then they developed long COVID. But that was so unprecedented, like the fear and the anxiety of going through COVID, like the uncertainty of what could happen. Were we all going to survive? We were all wiping down our groceries. We were not connecting with others. So much fear and anxiety during that time. And I think that kind of created a conditioned response in a way. And so we attributed our symptoms to the vaccine or through the illness, but and these are real neurochemical changes that are happening, but that's just the power of the brain. Just like when some people get rashes from stress or from the neuropathic response. So I would say that I really believe vaccines have been an advancement in medicine and healthcare, and we don't have to worry about our children dying from diseases. And now we're hearing more about measles. And as a mother of an 11-year-old, I get very nervous about the vaccine debate. I am pro-vaccination and I'm pro-health at the same time.
As you were talking about the fear that happened, I agree. There was so much fear. And I think that fear, some people's response to that was then transferred on to the vaccine itself through really poor leadership in every aspect in our country. Granted, they were all going through it for the first time too. However, we did actually know that something like this was on the horizon through like historical precedents. Like we knew, like epidemiologists knew that something like this was going to happen. We just didn't know what or when. And I think right now there's this whole like trust science, and people don't know how to trust science because one, it's done harm. It's not perfect. And two, science changes, but when it changes, it's not willy-nilly. It's based off of new information, and then we plug that new information into the old information that we had, and we create a new hypothesis or thesis based on the new information. And I think people really struggle with the ambiguity around that. That's the cognitive dissonance piece. And that's where therapy comes in as well, because the cognitive dissonance piece is really hard for a lot of people to live with. And cognitive dissonance is just when there's two different stories in your brain. The vaccine is good, the vaccine is bad. And there's evidence for both, evidence based on what people are hearing, seeing, reading. There's evidence for both. And people can't live with that there's two realities. And so they cling to one reality. And then they only the evidence that backs up that reality that they've chosen. It's really hard to live in the gray and to live with ambiguity. I even wonder, you said earlier, like the COVID shot may be giving long COVID. And I just wonder, do you think that we know that some people had COVID and they were asymptomatic. Do you think that the vaccine really caused long COVID, or do you think it might have been something like that? I would defer to your judgment on that.
Yeah, I mean, that you raise a really good point, but I think there have been some research studies where they looked at people, at least they had no documented COVID. So that could be a limitation for sure.
Okay.
But I think it would still not justify the number of people who, I may be able to find that study, but it would still not justify the number of people who did get the vaccine, who had COVID or had long COVID. It still would not justify, even if there was like a small sampling of people and they're asymptomatic.
Okay. And do you think that was a fault of the science, the fault of the way the vaccine was developed, or do you think that was any vaccine would do that regardless?
I think it was the context of just the entire situation of when the vaccine was delivered, and it was so anxiety provoking and scary. It was like the end of the world feeling, and I think it could be equated to the flu pandemic, like in 1918, and if you look back on that time in history, I'd have to do a little more reading, but I've heard talks alluding to post-COVID being very similar to that time frame too, because there was a lot of death and despair and tragedy, and it's like that imprinting into the nervous system and creating that fear response and then generating real physical symptoms in the body.
Yeah, that makes sense. I'm just sitting with that. I agree. I think fear is really impactful and does make our symptoms so much worse. And then we come back to okay, so what do you do about that when you can't control whether you're scared or not? But that's where, going back to everything we were talking about earlier, having a trusted community around you, listening to, even if you don't trust certain sources of information, like I actually just shared my story with this nonprofit called Voices for Vaccines, and I used to be very anti-vax, and this is a very hard thing to talk about as somebody who's a health professional, and I have swung like the complete other way, and I can even sometimes get a little bit angry now, like at people not taking their vaccines, and that's not fair either, because I was absolutely on the other side. But what I wanted to say was, listening to information that you may or may not agree with, you've got to figure out how to surround yourself with trusted information, but sometimes there is a path to get there. I did not trust the science when I first decided that I was going to start being more open and being willing to listen to it. I just knew that I had only been in one type of environment my whole life, and that I needed something different to help instill, just to give me more options to choose from. I did not trust the science. I thought everybody was paid by Big Pharma to do studies that said whatever Big Pharma wanted. And it was only through learning about how research is done. And yes, there is absolutely really bad things that happen in science, in functional medicine, in naturopathic medicine, and no matter what, like, you are going to have bad players. One of the things that really helped me was understanding, like, when a study can be repeated over and over and over again, and how that's what makes it gold standard. And I just don't think little things like that, I just didn't have. It's science literacy, which we're not taught in school unless you go into that field. But yeah, I just think this is an important conversation to have, especially right now as our government is trying to limit COVID vaccines further. There is a lot of fear. And
Definitely. And I was reading about that actually yesterday, and I was creating anxiety for me, but I definitely can see where this lack of those gaps, because the brain will fill in like those gaps with what it knows. And it's so important to just maybe those, like, you understanding the gold standard and seeing how rigorous science is, even though there are definitely black players, no doubt. But the overall premise is solid. And but it's something that we all individually have to work through in our mind. And like you said, it's like holding two opposing viewpoints, because when you do hear the stories of people who have suffered loss and tragedy, and your heart just feels, what if there is some truth to that? And it's so, but I am really, there's a lot of anxiety and fear that I have about collectively that I'm feeling from I'm sure all of us are feeling.
Yeah, absolutely. And one thing you kept talking about around your work with your clients and your coaching capacity is basically the education. And that was what brought me to this line of thinking, was like, education is always going to be, it needs to be a part of every treatment modality. That's why physical therapists are so big on pain education. It's why I'm so big on pain education. It's why, because that education then creates beliefs, and those beliefs are then what help you make decisions that are more in alignment with what you and your body needs. But the beliefs,
I love how you said that.
I think I've thought a lot about, because most therapists are trained in like an ordinary cognitive behavioral therapy kind of way. And I historically have been very anti-CBT, because for me, that was always presented as like the thought you're having is wrong. This is a better thought. So you should have that thought. And then that thought's going to lead to healing. And there's no extra context. There's no there's no pain education. It was just like your beliefs are wrong and they're hurting you. And it's basically your fault. And any CBT therapist would be screaming right now if they heard that. I've heard it before. They say, that just means it was a bad CBT therapist. Fine. But there's a lot of bad CBT out there. I think we just have to do better. We have to really understand how beliefs are made. And it's not as simple as just changing your belief. Your brain needs a lot of repetition and a lot of education before it will actually fully internalize and absorb that belief. So I think that's where, for practitioners and coaches in your capacity where you do have that medical knowledge and you're not just saying, yep, all of that is wrong. I think what people don't realize too about like holistic medicine that demonizes Western medicine is that you're actually just creating further distrust, which is then inherently worse for the body as well.
Yes, definitely. And the way you said everything is, I just agree with you 100%. We need all of that, the repetition, and it's not about labeling good or bad ways. And a lot of this is education. And, I find myself in my own coaching that I get mentored. I learn something and then I have to be reminded gently, oh my God, how did I just miss? Our brain is just so clever at filling in the gaps, and we need that repetition. And it's education. That's where we change our belief. And then we know we can really see too what is best for us. Because if we don't change our beliefs, there's no space to make that decision either. But I love how you worded it, so practical and so true.
Thank you. Yeah, it's been a long journey. Good. So anything else that you think is important for people to know about what someone like you and your role is in their chronic illness management or chronic pain?
My biggest message is that pain is a part of human life. It's part of the human condition, pain and pleasure. But the suffering around pain really does not have to be as severe. There is hope. There are options. There's a lot of free resources on my website. It's undergoing an update, but what I'm going to offer is a bunch of links to a lot like the Association for Treatment. And this is more for neuroplastic symptoms. They really can apply to any symptoms. And the beauty of this work is that there's really no main side effects other than more authenticity and understanding of ourselves. Because if we can understand ourselves better, we can understand our pain better, we can have better relationships with the people we love and care about. And it just improves the quality of our life. And we are actually more present for our life. And that's where we can access joy and freedom. And it's honestly just a beautiful journey to be on. And it just never stops. The learning never stops.
It doesn't. You're absolutely right. I actually do have another question. Did you say that in your coaching, you are mostly working with nociplastic pain? I know the three main types are nociceptive, neuropathic, and nociplastic. And I'm just wondering if you can explain, even just in my mind, they have to all be connected, but I think we talk about them as individual types of pain. And so I'm wondering if maybe you could explain a little bit about that.
Yeah, definitely. And so neuroplastic pain, just to go back to that point, is I would say is like a subset of nociceptive pain, like it's an umbrella term. But basically, if you look at pain in kind of three categories, there's a nociceptive pain, which is like pain that's like your neuroception is picking up from all like real neurochemical tissue damage, like you break your ankle or sprain your ankle or you get a rash and you have some redness and heat from it. All of that's coming to the brain, and then the brain is interpreting that brain. But it's from real tissue damage, neurochemical or structural damage. Then there's the neuropathic pain, which is from nerve damage to the nervous system. So you can see that in radicular pain, where people actually have the nerve is being pinched or it's inflamed or damaged. And then there's nociplastic pain, which is pain that is almost learned from the nervous system. It's like a neural network, like a neural circuit. It's almost like you're looking at a picture and you see it Do you know the picture of the lady where like it's her side profile and you can either see an elderly lady or you can see a young girl looking far off?
Yeah.
It
Yeah.
becomes like a neural circuit pathway.
Yeah.
And what so it's almost like becomes a learned pathway. And it, in my opinion, is that it gets imprinted due to, like we talked about, some kind of very big event or traumatic event or a stacking of a lot of things that were happening simultaneously, where it just becomes ingrained in our nervous system. And then we even see through functional MRI that these pathways become more sensitized in chronic pain, and then the emotional centers also light up. Whereas if you see an acute injury, you see more like at the physical center. So a lot of this work really looks into those pathways, but it really works for mixed pictures of pain. In my opinion, that's usually more of what I see because it's not black or white. It's really like some structural or some history of an injury, but maybe modern medicine. No. For example, a lot of neck, back, low back injuries. Unfortunately, modern medicine doesn't have a lot to offer other than interventions like anesthesia type epidurals or procedures, but then people still have pain and they're going through physical therapy and medication. But sometimes doing this work can really be life changing because we can see how that we don't go through that disability spiral in a way because we're like saying no to this hurts me, so I don't want to do this activity, or oh, I don't want to show up for this. Not in a judgment or a stigma way at all. It's this is because our brain is trying to protect us and it thinks that we're doing more tissue injury or structural damage by engaging in these activities. But in essence, we're making our world smaller on a physical level and emotional level and
It
a
really,
connection level.
yeah, I agree. I agree. I think what came to mind is because kids, when they like touch a burning stove for the first time, it takes them several seconds to remove their hand because they don't have those receptors yet to tell them to move immediately from the pain. And
Mhm.
so even something like an injury, which I think you called, which kind of pain was that?
That's the nociceptive.
Whereas I'm seeing that even as also overlapping with the learned pain. Is that
The
accurate?
nocioplastic pain is when your brain learns the pain. So maybe like you go to you didn't touch the hot stove yet, but you got burned from the stove. So you think you touched it, but you didn't. And then you feel like you got burned. Or
Yeah.
you hear a noise, or you get like war veterans, like sometimes they were injured in duty and and then 20 years later they hear a helicopter hovering and it reminds them of being in the field where they got injured and then they feel like they got injured all over again.
Yeah, and then when that gets even more amplified, like the creaking of your bedroom door might sound like that noise to you, even though it's totally different. But as you get more and more sensitive and avoid more and more, that's what you meant by our world getting smaller. Like now the creak of a door even sounds like the helicopter, which sounded like the bombs going off. I liked the
Mhm.
example of you don't even touch the stove, but because of the memory, you actually feel like you physically feel like you just burned yourself again. And I think that is why this conversation usually feels so tricky for me because we are working with people who have legitimate health issues. And so when we start to talk about nociceptive pain, it's not really hurting you. You just think it is. So we need to change the way you're thinking. And it's
Mm.
actually most of us are living with a chronic illness and there is something happening. There's inflammation, there's endometriosis pain, there's joint pain. Like it is not purely because we are overly sensitive, although the hypersensitivity occurs because there is damage. There's more and more like I think that's the tricky part is the conversation always goes into nope, there's no more damage happening, but you think there is, and so your pain receptors are high. And it's like, but like I know when I feel inflamed and when I don't. And my pain feels different in my joints when I wake up inflamed versus when I'm less inflamed. I can tell that after one glass of wine, I can tell that after one bad night of sleep. I think I am more sensitive to my pain receptors than maybe other people are, but that doesn't diminish the fact that something is actually happening in my body. And I don't this leads me to, I also don't want to encourage this message of, so anytime you feel pain, something's wrong. So therefore that's also not
Mhm.
true. So it's a tricky conversation.
Yeah, and it's so nuanced because we don't want to make anyone feel stigmatized for feeling pain. Pain is real. All pain is real. It's really experienced. And even neurochemically, those things are happening in the body that are
Right.
triggering the pain. But what we're saying is that it's still an experience that the brain is making, it's making it to mean pain. Just like when we're seeing each other, the light's coming in, but 90% of the fibers, the interpretation of what we're seeing is based on our beliefs, our thoughts, the context of how we see ourselves in the world and the world. I think a lot of this work is, when I say the world gets small, at least for me, because of my chronic pain journey, is I would limit myself from doing even exercises because I was, or activities. And it was so hard for me because I was like watching my daughter grow up, and she's very, she likes to do stuff. She's like a lot of kids, but I always joke that my husband is, she's like my husband. He's like very athletic.
Yeah.
And so I felt like I was like less favored because I couldn't pick her up or throw her over my shoulder, but then I would also say, can't do that because it took me, doing this work really helped me realize like some of that was a conditioned response. Yeah, maybe it would hurt a little bit, but I would be fine. I could do those
Yeah.
things in
Yeah.
spite of the pain without causing damage to my body.
Yeah. That's why I really, like, when I'm first working with a client, I'm almost always first trying to get them to just figure out how long they need to recover from something. Because once you know that baseline data, let's say you're scared to play with your daughter, but you play with her anyway in an effort to overcome this, and you feel really fatigued that night, and maybe your back is hurting, right? And then that would lead up doing these avoidant behaviors of, I'm not doing that again because I just injured my back further. Look at the damage I did. And so before I even approach trying to get somebody to go in and change that behavior and just play again tomorrow or something like that, we have to know how long it takes you to recover. Does it take you 12 hours? Does it take you 24 hours before you feel like you are back at the baseline that you were before you were playing with your daughter in that instance? Does it take you 2 weeks? Okay, if it takes you 2 weeks, that's what it takes you. But before we start trying to change anything, I'd be curious to know like how you approach this with clients too. For me, and I think some people might disagree with this because they would say that's avoidant behavior. But to me, if you don't feel safe while you are then trying this thing out again because you don't fully yet believe that you're not doing damage or that you are okay, then you're gonna actually hurt yourself further. So I think that when you do practice honoring how long you need to recover, the recovery time shortens because you are actually doing the recovery practices like relaxation, breathing, ice, heat, water, etc.
Yeah. No, I think you brought up a really good point. Again, it has to be very individualized. And I think when you get to know somebody and you know their rhythm, you know what their life looks like, and you get an intuitive sense like, okay, this might be just, they need to just go for it and do what they want to do. This is more fear based. This is not really actual based because there is a lot of work too to know your body's cues. Like if
Yeah.
you're like even in migraines, you can, maybe the day before you're starting to feel fatigued and you just didn't have, you're so used to pushing yourself all the time, you can't tap into that. And you can even avoid the intensity and frequency of your migraines
Yeah.
by just picking up on your body's cues the day before or two
Yep.
days before even. So I think there's a lot to be said with really having that awareness of how your body is and feels without judgment of, oh, I can or I can't. This is
Yep.
just data. Then you really can make some well-informed decisions.
I love that. Anything else that you want to share about what your work looks like before we end today?
My goal is just, I feel really passionate about this work because I've been in the traditional model for so long and it really was the missing piece that I needed. I feel like for my own healing, but I also feel like for the people I help. And it just want to be of service to really help reduce the suffering around pain and illness. I think a lot of the answers to solving this is really from our own innate wisdom, and it's not in the how or what, it's just in the being of it sometimes. And it's like giving it space. And there's a lot of power in just softening emotions and frustration and fear because, just like joy, they're just all meant to be there. They're
Yeah.
all meant to guide us. And I think having this journey, even though it's hard to really say this without getting emotional, is like because it gives you that courage to really speak up for the life you truly want. And maybe you've been suppressing yourself or trying to fit into something that wasn't meant for you. And so it really gives me that authenticity of really being in alignment in my mind, body, and soul.
Yeah.
Although I would never wish pain or suffering on anyone, I wish everyone peace and love and feel great in their bodies. But I've heard a lot of people who go through pain and hard times in their life, you want to make meaning out of it.
Yeah, absolutely. Yeah, we don't force the meaning making, but eventually at some point, making meaning of it is a really big part of the healing journey as well.
Definitely.
Thank you so much. I will link all of your information in the show notes. And yeah, I'll let you know as well when this goes live.
Perfect. Thanks for having me. And I hope to do this again soon.
Thanks for listening. If you learned something new today, consider writing it down in your phone notes or journal and make that new neural pathway light up. Better yet, I'd love to hear from you. Send me a DM on Instagram, email me, or leave a voice memo for us to play on the next show. The way you summarize your takeaways can be the perfect little soundbite that someone else might need. And lastly, leaving a review really helps others find this podcast, so please do if you found this episode helpful. And P.S., clicking subscribe ensures you'll be here for the next episode. See you then.